Hello, welcome to today's discussion. Today we're going to have a conversation on acne, and this is in line in us marking the Acne Awareness Month, which is marked in June. It is an opportunity for us to shed light on one of the most common skin conditions. To help us deep dive into this and reveal the truth about acne, we're joined by Dr. Carol, who is a consultant dermatologist, and she's going to really shed more information on acne, the myths surrounding it, and how to debunk most of these myths. Karibu Daktari.
Dr. Caroline Mwatha is a dermatologist, a venereologist, and a cosmetic surgeon. I practice in Nairobi, Kenya, and I work for the government, and I run my private practice as well.
Now let's start with the basics. What is acne, and what are really the main causes of acne?
So acne is an inflammatory skin condition.
Yes.
Inflammatory because it starts from within as well. It's not just something on the surface of your skin. It's an inflammatory skin condition which leads to production on the skin of comedones,
Yes.
which is like actually the primary lesion you see on the skin. What you see on the skin and you say this person has acne is called a comedone. So a comedone is like a closed pore on the skin with an overburden of bacteria with inflammation within it that leads to this disease that we call acne. So what causes acne is, first of all, and most importantly, your genetics. If you come from a family where people's skin is acne prone, you have a very high chance of developing acne. We've seen that, especially in teenage, acne prevalence is quite high, up to around 80% worldwide.
It's a big number.
Yes, it's quite a big number, and it's downplayed a lot. Yeah. So genetics is a big deal. Hormones, and I will group this into two: teenage hormones, where we mostly don't do anything about the hormonal imbalance in teenage because we mostly expect that it's going to resolve on its own.
Exactly.
And now a hormonal imbalance that will occur later on in life, especially in women, for instance, polycystic ovaries and hormonal imbalance that comes from within. Acne is also caused by some medications.
Yes.
We see it a lot with, say, steroid-induced acne. So by topical I mean what you apply on the skin. So some topical applications contain steroids, mikorogo. Okay, that would initially make you look good. Maybe someone wants to be a bit fairer. Maybe you don't even want to have a fair skin, but you go to this person and they ask them, what can I do to my skin to get rid of this acne? They give you this combined treatment.
So it's more like a quick fix.
Then it leads to a very bad form of acne later on. So steroid-induced acne. There are some other medications that can cause acne, like tuberculosis medication, thyroid medication. I've seen that happening quite a lot and distressing people. So such medications can cause acne as well. You can get acne from contraceptives as women. You know, I always tell women, when you go to a doctor and you it's good you open up. Like if you go to a gynecologist and you just tell them, I want a contraceptive, or a nurse, and you didn't tell them, you did not tell them about the conditions that affect you personally. Like I struggle with acne and what have you, because we have a whole range of contraceptives. So there's always something for everyone. So if you get a contraceptive and it causes you to have acne, there's no problem with you going to tell even a nurse in a public hospital that it's distressing you. So contraceptives do cause acne, and there are some that, if you are acne prone, you can get acne. And if you come off them and go into other forms of contraceptives, it can resolve the problem on its own. So these are some of the common conditions that we see causing acne. Diet as well. You are oily, acne prone skin, and you're not strict with the kind of things that you eat. You eat lots of dairy fat, lots of sugar.
Yes.
You prompt yourself into getting now full-blown acne as a disease. Yes.
Oh, that's quite broad. Well, if looking at acne, I think from my side, people just think, it's just a pimple that pops out, and that's acne. What I really mean to ask, are there different types of acne? And if a patient has acne, how will I know as a patient whether it is mild or severe. Okay. Is there any parameter that a patient can know? If this is the acne that I'm suffering from, maybe it's severe, I can go to the doctor at this point. And what is the best time for a patient to seek doctor advice?
Okay, so dermatologists, we categorize acne as inflammatory or non-inflammatory, and that's just helps us with medications and how to monitor you. But I want to break it down the way we do it to patients. So we have mild acne, a moderate acne, and a severe acne. So a mild acne would be like a few comedones on the skin, whether they are closed or open. So a closed comedone would be like white in color. An open comedone would be black in color, and I might explain this a bit later. I'm sure the question will come up.
Yes.
So a few comedones on the face, you would be categorized as a mild acne. Moderate acne is comedones that are more on the face, like a bit dense on the face.
Yes.
And maybe you already have signs of some scars, like post-inflammatory hyperpigmentation. You are forming some scars already. And there's some signs of inflammation.
Yes.
Not so severe, like some erythema, redness on the skin, graying and scaling on the skin in our skin of color, because it's not everyone you'll see redness on their skin. So
because of our complexion. If
because
I'm
of
dark,
our complexion,
you wouldn't know what is red.
Yeah, so inflammation would look like some scales and a bit of graying or silvering of the skin. So that would be categorized as a moderate acne. Is that
also associated with dryness? Because scaling...
No. Whether you have oily skin or dry skin, you will exfoliate. So oily skin can form scales on the surface and be confused for a dry skin, whereas it's not. It's just scaling. It's just a scaling of the skin. And then you'd have severe acne now. Severe acne has full-blown inflammation where the skin would look red or would look like it's uniformly scaled. We also categorize it as severe acne if it's affecting several parts of the body, in that we would not just use a simple medication on you. So maybe it's affecting the face, the chest, the back and the shoulders. If it's acne that is forming cysts, a cyst is like a ball containing fluid or containing sebum in your skin. So if it's forming cysts, you'd see a doctor maybe touching your face to see if there's something they can palpate, so they can feel underneath
bumpy,
your skin. Yes. If it's bumpy, it's a cyst, and it can form nodules. So nodules are toughened cysts, like they don't contain any fluid in them. They're just hardened with material in them, keratin.
It's really interesting to know that the cyst will actually have fluid under your face.
Yes, a cyst has fluid and a nodule does not have fluid. So this we categorize as a severe form of acne. Some acne can even come with fever. It can come with inflammation that is general. Fever, and also acne that comes with other syndromes, like an acne which also causes pimples on the scalp, what we call folliculitis decalvans, acne that causes a hidradenitis suppurativa, that's sinuses in your armpits, underneath your breasts. So syndromic acne would be categorized as a severe form of acne. Yes.
A lot of science there, Daktari. I'm sure most of it will be technical jargons for us, but well, if it's severe and gets that technical,
people Google a lot nowadays.
We know we have to come to the doctor.
Yes.
But when it comes to acne, there's so many myths and misconceptions around acne.
Yes.
Thinking that it's just an ailment, it will go away on its own. Others are having the whole misconceptions of maybe toothpaste applied will just work. And people even often talk about if I have acne, maybe it's because I'm living in a place that has contaminated air, water, fresh air. Yes. So I just change my environment and it will go away. So I want you to debunk these myths and misconceptions for us.
Okay. We see it every day. I even saw it yesterday. A parent not thinking that a child's acne is affecting them simply because they're a boy.
Yeah, it's so they came. It will go.
Yes, they came. Brought his daughter and his son to the clinic, and then the daughter was complaining of acne, and we were dealing with it. And then the son was like, "I also want to get rid of this." No, you're a man.
Oh my
You should wait it out and it should resolve on its own. I was like, no, teenagers are actually really affected by acne. Acne has been shown to even make people not go into some certain careers. Like, can you imagine you're training to be a cabin crew and you have acne? So chances of you getting employed, they already know this. Like, I need to look good to get this job. You work in a front office and you have acne. We get people in our clinic sent from spas because you cannot surely be working in a spa, in a salon, and you have an acne face. So
because you look at the product first.
You look at the person first and you're like, okay, how can I walk in here to be treated or to have a facial done on a person with by a person who already has acne? So it does affect people's career. That has been shown to be not as people were belittling this fact, but now there's a big movement about acne with mental health because it really does affect people with acne. They spend their time on their mirror. Someone who has healed from acne, they spend a lot of time and they are very anxious about looking at new pimples on their face.
I think the self-esteem also comes into play here. We talk about home remedies. How effective are they, and do they really work?
Well, I have heard a lot about tomatoes, turmeric, masking with avocado, I don't know, scrubbing with coffee.
Like turmeric is really big, I think, in our homes.
Yes, scrubbing with, I don't know, what have you, coffee and sugar scrub.
Honey as well.
Yes. No, I wouldn't say, treat it as a disease. That is why it's paid for by insurance. It's even categorized in the International Code of Diseases. Acne is a disease. Some home remedies, actually, research is going into more of natural products for acne treatment because even dermatologists are sometimes faced with this challenge. You are with a teenager. They're going to be teenagers for a long period of time. They'll start developing their acne maybe at 10 all the way till 21. They'll be having these teenage hormones. Are you going to be keeping them on medications throughout? No. So if we can get some natural products to help in managing this acne, by all means, yes. But most of the home remedies I've seen actually end up drying the person. And it was quite interesting. We were discussing how in some other forum how you do these scrubs and what have you, and you actually end up looking older. So when you gain knowledge
and damaging the integrity of the skin.
when you gain knowledge, you end up looking younger in your 30s and 40s than you are in your 20s because you are overdoing it.
You have, at that point, you have the knowledge and probably the affordability.
The affordability, you finally got money, or maybe you finally went to a doctor.
To a quality doctor.
And they told
especially in this era of social media and all that. You won't know who the true quality doctor is.
You stopped doing your own research and treating yourself. So you end up looking even better in mid-adulthood than you were when you were trying to experiment on your skin with everything that you could hear of. So home remedies for now, I wouldn't encourage it, but research is targeting itself on most diseases, actually, not just acne, towards more natural ingredients. And
and Dr. you've actually put it very well. Acne is a disease. It's a major disease, actually, classified 8th among the most common diseases worldwide. And it actually has a prevalence of 9.4, which is quite high. And now that you've told us not to try the home remedies, what treatment options do you have?
So for acne, we treat depending on the age of the person. We treat depending on the gender of the person and the stage of life you're in. For instance, if you're pregnant, there's it rules you out of most of acne treatments, actually. So if you're younger and you have even a severe form of acne, a doctor would be very hesitant to give you some forms of systemic treatments because it might have side effects that are not pleasant later on. you cannot put a teenager on hormonal treatment, for instance. So age is a big factor when we are treating acne. The other thing that is we mostly look at when we are treating acne is its severity.
Yes.
So you'll not treat a mild acne the same way you treat a moderate acne and the same way you treat a severe acne. The other thing we would look at is if there's a causative agent to that acne, like if there's hormonal imbalance post-teenage, we would treat it differently. If it's a steroid-induced acne, we would treat it differently. So is there a causative agent to the acne? Yes. So that's how we would manage it.
Okay, now maybe for a patient who will not want to visit a doctor and probably they have mild acne, is there any medication they will buy over the counter? And maybe you can also bring out what's the difference between the over-counter treatments and treatments that we'll get from doctors.
So over-the-counter medications, I would say, not really medications, I would call them dermocosmetics, would basically not worsen what you already have,
yes,
and kind of like stabilize it. Because acne does need to be treated. That is the truth. Acne needs to be treated. Mild acne, we would still treat it, but not necessarily with medications and what have you. So the dermocosmetics that you would use, for instance, salicylic acid at a certain percentage, and then I have to give a disqualifier here that you cannot extrapolate what you see out there in percentages that you see out there on skin of color. That has to come out very clear. Most of the time when products are produced, they're not targeted towards skin of color. So you would like maybe take something that at a certain percentage. So I mentioned, for instance, salicylic acid. I would mention retinol. I would mention AHA, BHA. You cannot use those skin active ingredients that were produced for people who are not of skin of color on you. Remember, skin of color pigments. The skin that is not of color does not pigment. Skin of color gets scars. They do not get keloids. We do get keloids. So you can do salicylic acid. You can do at a certain percentage, 2% and less, and a good acne moisturizer. At least the ones that do not clog pores.
Yeah.
So a good acne moisturizer that is mostly not a heavy cream, something like a light cream, not an emollient. So a good acne moisturizer and sunscreen.
Yes.
So for sunscreen, chemical sunscreen, which is mostly invisible, is what is meant for acne prone skin. By chemicals, I don't mean it's heavy in chemicals. It's just how we categorize sunscreen. So there will be a physical sunscreen, which is also called mineral sunscreen, and a chemical sunscreen. So a chemical sunscreen is, it contains ingredients that do not really create a film on top of the skin. They kind of like are just absorbed just beneath the top layer of the skin.
The cosmetology is more agreeable.
Yes, it's absorbed just underneath the skin, not forming a film on the skin, and it filters the sun's rays. So yeah, I'd say a good face wash, preferably with 2% salicylic acid and below, a good acne moisturizer that does not clog pores, and a sunscreen. That would be a good place to start from.
So actually, because we're having so many products over the counter, so I should not actually go for maybe a retinol-based wash without the doctor's advice, because the concentration will actually be tailored by the doctor, because that is meant for
their skin type. Now they're trying to make products for skin of color. It's not easy. It's actually not easy. Skin of color is good in that it already has melanin, and we age slower because of this melanin factor in us. But the challenges of pigmenting and the challenges of scarring inhibits us from using very harsh, high percentage products on our skin, as opposed to what they would use even over the counter. So for us, go to a doctor and get your advice from a doctor. That is what I would advise. Yes.
So Dr. we've talked about scarring. It's coming out so strongly here. So for anybody suffering from acne, you mean to say here scarring is the end point? We can't recover from scarring, And again, what will prevent scarring? Does it mean that we start the treatment early, or if it's going to scar, it's going to scar?
No. The end point is not always scarring. Scarring and pigmentation. The chances are just very high, extremely high, that you will get scars and pigmentation if you do nothing about it. Preventing scarring is very possible. Actually, some of the treatments that we give for acne do as well prevent scars. Yeah. So especially the tretinoins and the retinol-based products, they do also function in preventing scars. Sunscreen as well, it works by preventing post-inflammatory hyperpigmentation. So during treatment, we can also do something that can help you prevent scars. It's not always the end point of acne. If it's noted early and treatment is started early and a skincare routine is started in good time, it's not always the end point of acne. But as a skin of color, the chances of you scarring if you do nothing are very, very high. Yes.
Let me just ask this. When it comes to acne and scarring, is it more predominant in men or women, or it's just a mixed bag?
Actually, acne has been seen to be more common in men, I think because of the higher testosterone levels. Scarring, it happens uniformly. I would say women trigger it more because of experimentation. I actually say people think men don't go to see dermatologists, but I joke with people that if a woman has a skin problem, they would experiment with other things first. But a man, once they notice that this is a problem and it's bothering them, they're not going to start experimenting with any other thing or visiting here, looking for opinions here, and then they would straight away go to the dermatologist. So we do see men quite a lot. I would say women trigger their scarring more, by my experience, because of the experimentations they would do. But yes, scarring by science affects both uniformly. Acne is more common in men. Yes.
And I think when you talk about women, triggering it more, you also mentioned mkorogo. I think from my research, when you talk about mkorogo, it's us women who are much more affected because we want to really go and try what my friend did.
Yes. Ask for advice here and there.
Yes.
Yes.
Great. Great learning. And what other complementary therapies other than the treatments that you discussed?
It's not so common in Kenya. Acne. So I will actually take this opportunity to mention some things that occur naturally that can help with acne. Okay.
Great.
So one of them is actually something I used myself. It's called witch hazel. It's not sold so commonly in Kenya, but I got mine from the US. So witch hazel is something that it's a plant that is a natural astringent. So it helps, and at that I quite often recommend it for women who are pregnant.
Break down astringent for us.
Astringent.
Yes. I'm sorry. That one is a complimentary one. Everybody wants to know what it is.
An astringent is something that dries sebum from the skin.
Great.
Yeah, so
it's doing naturally, so the face doesn't end up.
It doesn't dry so much, so it's safe even in pregnancy and breastfeeding. And
that is so good because you mentioned that in pregnancy there is no treatment that is really recommended.
No. Doctors don't no medication is safe in pregnancy. And that's proven already. So witch hazel, lemongrass is a good natural remedy. The boiled water from lemongrass, cooled down and left in the fridge for 7 days. It will reduce the inflammation. Someone who's had acne will tell you it's very itchy and they always feel like scratching their faces. And that's the other thing that causes scarring, picking out pimples and scratching their faces. So lemongrass tea, cooled down, is a very good soother for acne and kind of like a toner.
Cooled down, not hot.
No, you will boil it. You cannot put it hot on your face. So you need to.
You apply it. You don't drink it.
No, It's applied on the face. You can drink it, of course. It's a tea. It's a lemongrass tea. Yep. You can drink it, but even applied on the face, like a toner sort of, or something to cool your skin down, it does a very good job. And it only lasts like 7 days, and you have to discard what has remained. Aloe vera, that's a good, I would say, a natural occurring acne moisturizer, because it's a moisturizer and it does not clog pores, and it also soothes the skin. So you can try some of these home remedies. There are more, but those are some of the ones that you can find that actually work. Other remedies that we do try are laser. We do use laser as well, NDAG, which is safe in skin of color, to kind of like close off the acne comedones, and also reduce pigmentation that comes with acne and acne scarring. We also do chemical peels for acne, and again, this has become a problem because people are self-teaching themselves to do chemical peels. And as I told you, there's a lot you can do in skin type 1 to 3. Like skin type 1 to 3 are basically Caucasians and people from the Far East, that you cannot do on skin type 4, 5, and 6. Those are people now who are South Asian and African mostly. Like, think about it like that. Because if you...
our skin type is...
for us, so Asians to Africans, we fall under 4, 5, and 6.
4, 5, and 6, yes.
So if you, for instance, do a chemical peel and it's a bit too harsh on you, you will scar and you will pigment. Things that will not happen as easily. They also do get scars, but their scars are not as visible as a scar would be on a person of skin of color. Yes. So extrapolating should not be encouraged, and doing these procedures by yourself should not be encouraged at all. Like, so chemical peels, you can do that. There are some home-based chemical peels. I'm putting a hyphen because their concentration is quite low to qualify them as a chemical peel. So an AHA, BHA.
So these are the ones that you apply as a mask then peel off, or are they the scrubs?
No, they're not really the scrubs. They are like, it's still something that you apply and you wait for a few minutes and wash off. So we have some AHA, alpha hydroxy acids and beta hydroxy acids that have been combined for home remedy. Still, I wouldn't encourage that per se until you visit a doctor, because it also depends on what else you're using. They might counteract with these chemicals. So those are the other remedies that we use for acne treatment. And nutrition. We are so big on nutrition. A doctor will talk to you intensively about what you're putting into your body, because your skin is highly responsive to what you're eating. It's the biggest organ. So you can always say, you can walk into a doctor's office without judging. We will tell what exactly you're putting into your body.
Your diet, what you're applying.
Yes.
Even before I open my mouth.
Yeah, we will just be asking questions to maybe confirm our suspicions without judgment. We don't judge. We see people every day, many people. But yes, so that's how big what you eat is. It can show you. It can show on your face. Yes.
So that brings me to my next contribution. So it really means that my lifestyle has a lot to do with my acne or my skin health.
Yes. And even for big actors and actresses, they are always questioned on, they have to get nutritional advice. The skin is the biggest organ of the body. It's the most visible organ of the body. It's what is exposed to the outside of you. What you eat really, really matters. Your water intake really, really matters. And to tackle bad skin and acne, not especially, but even when we cannot do much about it, we will sit you down and actually ask you, what is it you're eating? So for acne, I cannot say there's been papers that have been written to really condemn some foods, but a doctor will, by observation and years of practice, they can tell that actually over-consuming of sugars, over-consuming of dairy fat, especially oily foods, especially dairy fat, does cause problems with skin. Wheat, it's gluten, and by what I see, eggs. So eggs consumed beyond the dietary recommendation of 2 portions in a week. Wheat consumed beyond the dietary recommendations of 2 portions a week. Dairy fat, I actually advise my patients to just eliminate it, because you have other options. You don't have to eat butter, the factory butter, that's margarine. You can live without ice creams. You can live without dairy fat.
Yes, true.
For sugars, I also encourage patients to go low on sugar as possible. If you can quit it, why not? But if you can't, reducing on your sugary snacks intake, reducing on the amount of sugar you take in a day, even frequently taking tea with sugar. Cumulatively, you take in a lot of sugar in your body. Yeah, so papers have not been written. Do not quote me anywhere. This is by observation
and by experience.
And by experience, and before we condemn some industries into oblivion because of the skin, actual research needs to be done. So this is just by observation. Water intake is very key for good skin. It doesn't matter how much you're caking on your face, what expenditure you're using on your face, what you eat, and drinking a lot of water is quite a big deal on how you end up looking and how your skin ends up looking. Yes.
Does makeup worsen acne?
No, makeup does not worsen acne. Again, makeup coming from genuine companies is categorized for dry, sensitive skin, for oily, acne-prone combination skin type. If it comes from I always advise patients, because you'll not stop them from wearing makeup, and people have actually done research on what not to put in these makeup products that will prompt acne in an oily, acne-prone skin type. So if it comes from a good company, it does not cause acne. It does not clog pores. So makeup that does not clog pores will not propagate acne. No. If you're in doubts, and if you don't know, if you cannot afford good makeup, I always advise patients, because I understand, like, even during treatment, you need to kind of like camouflage sometimes. Maybe,
very true.
Yeah, your job requires you to look good, or you like looking good. You can add on a powder. A powder is always a safe add-on to your face. You can make your eyes, your eyelashes, your eyebrows, your lipstick, and then just add on a powder if you're not very sure of what kind of makeup to get, until you can afford makeup from good lines that are specific that this is an oily acne or oily combination skin type makeup that does not clog your pores. Yes.
So suffering from acne does not mean that we don't have to look good. We just have to go for the makeup,
the right makeup, and of course you have to be more careful now with cleaning of your brushes, and because acne and an oily acne prone face, I'm not saying that if you have dry sensitive skin or normal skin you don't have to clean your makeup brushes, but of course if you have a skin that is prone to being inflamed because of dirt and bacteria on the skin, you should be careful with cleaning your brushes quite often. I would say even after 2 days, you just clean your makeup brushes, and good.
So, Daktari, once a patient has come to your clinic and maybe the skin is clear, do they have a regimen that they can maintain on? And also, I'll also want us to discuss, do we have people who have acne-prone skin and others just have no issues with acne at all?
Yes, we do have people who have normal skin. They can virtually use anything
and they'll just
and,
be okay.
And they would be fine, or maybe they would pop a pimple here, and once they stop whatever it is that caused that problem, their skin just goes back to normal. And we do have people with dry, sensitive skin. Yes, so for acne that has resolved, as I said, a good doctor will listen to what you like, because we are not really marketers of certain products, but after you talk to us about what you use and the amount of energy you're willing to put on your skin, we can direct you on a good skincare routine for yourself. We always advise most doctors, or at least myself, I would like to see the product that you were using before. I would like to see them. Do you sell them yourself? Where are you sourcing them from? Do you like supermarket-based products? do you have someone who imports for you products? I mean, if you have someone who lives in the US and they happily buy you skincare routine,
yes,
why would I stop you from that privilege? So by seeing what you use, we can direct you well. There are some ingredients that we look for, and some that if we definitely see in your skincare routine, we do not want you to use them. So as I said, a face wash that at least exfoliates your skin a little bit, just a little bit, enough for whatever you apply on your skin to actually penetrate a little bit. So a face wash that I prefer, face washes that have 2% salicylic acid and below. I would put you on an acne moisturizer. Acne moisturizer, we mostly look for ingredients that reduce the sensitivity and pigmentation of your skin. So something like niacinamide being in the acne moisturizer is a good thing. We would look for humectants that do not clog your pores. So preferably something that not like something like oils per se. Glycerin would be good. It's light enough. Not an oil. We don't like you using oils on your face. And there's this common thing, clogging of the people applying coconut oil on their faces, and that just can clog your pores. So less oil.
It is actually very big and very common as a moisturizer. That's what most people think.
No, we don't like that at all. So some few retinol, mild retinols and retinaldehyde. So quite mild. Being in the acne moisturizer is not a bad thing. Yes, so those are some of the ingredients that we look for. We would avoid a moisturizer that contains ceramides, that contain, for example, as I said, oils, hyaluronic acid at a certain age. When you're not really in the aging category, a moisturizer that contains hyaluronic acid might again lead to you clogging your pores and propagating acne. And of course, as I discussed before, and a sunscreen. A sunscreen is key in the management of, or rather in a post-acne skincare routine, basically. For these other skin active ingredients, we would add them on top based on what your current struggle is. So if you have pigmentation, we would put in a skin active ingredient that targets pigmentation. For example, a retinol, an azelaic acid at a percentage that is safe for skin of color. If your issue is just looking dull and maybe you've not yet aged, but you're scared of aging, or you want just to look brighter, would put like a vitamin C at a certain percentage, that's 10% and below. If your issue is aging, no, that's when so the skin actives, we add them on, and we mostly advise on application of this at night, because we live here in the equator where you might apply something that sensitizes your skin to the sun. So we mostly advise for skin actives to be applied at night, and that will be based on, are you targeting aging? Are you targeting pigmentation? What do we want to do? Hydration, brightening of the skin? Yeah. So that's when we would add on a skin active ingredient.
So sunscreen here is very big on acne.
Sunscreen and the soap. Sunscreen and a soap that is good for oily skin type. A moisturizer is not bad, and a skin active based on the current struggle that you have or what you're aiming to do. So
there's a lot of learning around acne.
There's a lot of learning.
Yes, it's actually so broad, and my take home is that acne is just skin deep.
Yes.
So what we see is just a small part of what is happening in the body.
Yes.
What is actually the length of treatment? You know, most people, they want quick fix. They want, I want to come to your clinic and be like the model. I'm saying model. So, I mean, take us through the journey, because I think compliance comes in also in how the treatment works.
Yeah. So acne does not heal in a month. It does not heal as fast as you would want it to heal. Acne, on average, takes around 3 to 6 months to treat. Some unlucky people even need more than 6 months of treatment. It is a disease that develops in a follicle, and the follicle runs, I know people know epidermis, dermis, and this hypodermis, subcutaneous layer. So acne, the follicle of acne runs into the dermis, actually the deep dermis. So normal skin, the epidermis exfoliates in a month. So if acne was possible to exist on the epidermis, you would need a month to treat it. But this is a condition that is happening deep in the dermis. So it needs more than a month to treat it. On average, I would say 3 to 6 months. And lots of patients, initially you might be given a medication that purges your skin, that now pushes out the comedones from deep into the skin, and it ends up appearing as if your acne has become more inflamed or more visible, what we call purging. So that does happen, but you keep on the treatment, and if it bothers you too much, as I always say, you can always go back to the doctor. Yes. So yeah, that would be what
yes,
I would say.
Daktari, thank you. And before we wrap up, I would want you to really tell us, is there any takeaway piece or of advice that you would want to leave with us?
I would say acne is a disease. Mm-hmm. Treat it as such. We do not dismiss you off from our centers if you come with acne, even in the public sector. We do treat it as a disease on our end. Parents, listen to your teenagers. Do not just dismiss them because it's a teenage acne. Maybe you had acne and yours resolved. Remember, nowadays there are quite a number of products. It's not like when we were growing up. Some of us didn't even use oil until we got into campus. So these are kids who, they are quite exposed. They are going to try to manage their acne. Whether it's a boy or a girl, they are going to try to manage their acne. So listen to them, and if possible, I would actually encourage you to just take them to a doctor. Let the advice come from a doctor. They would see you're taking them seriously. As I said before, all the other healthcare practitioners take acne quite seriously, because even I've seen even patients who have thyroid hormone imbalance, once given the levothyroxine, acne is quite a common side effect of this medication. They do get it and they reduce their dosage or come out of it completely. So it cuts across different fields of medicine. I already mentioned about contraceptives. Be careful with acne patients. They already have some mental discomfort with how they look like. So don't ignore how they look like, and don't give medications that cause acne and tell them to be okay with it. They are not okay with it, and take it seriously. Yes.
So as we close, maybe you can just tell us where can we find you if we have more questions, and how can we get in touch with you?
Okay, so you can find me at Sonrol Medical Center. It's located at Ola Energy Plaza, formerly called Mobile Plaza, at the Muthaiga roundabout, at the junction between the Muthaiga Road, the road that heads to Gertrude's Hospital, and Thika Road. We are on the first floor, just above Chandarana Supermarket, and we accept medical insurances, we accept cash payments, sometimes we do activations, as I said, so that is where I'm found at mostly.
Thank you so much, Daktari, for such an informative, insightful session. We have learned a lot about skincare, and I'm really looking forward to more of these sessions. My take home for today has been that we should really be mindful of our diet. It really has an impact on the health of our skin. Let's hydrate, and tuachane na korogo. It really has a negative impact on the quality of our skin. Always remember, just like an artist creates a masterpiece and perfects his craft, you are the artist of your own skin journey, and take control of your skin's story. Thank you so much for joining us today. Join us in our next episode as we continue to mark the Acne Awareness Month. Asanteni.